Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Lubna from PJMI AMC Lahore. The topic that we're going to cover today is a very important one in the neck because it comes in the deeper dissection or deeper structures of the neck. First of all, we're going to talk about the prevertebral region. As you can see here in this diagram, we can see that region, but to be more precise, I'm going to tell you the details and the boundaries and the contents of this region. So, the prevertebral region is located deep in the neck, and it contains the prevertebral muscles of the neck, which are relatively weak flexor muscles and extend in front of the vertebral column from skull to superior mediastinum. They are covered anteriorly by the strong prevertebral fascia and lie directly posterior to the retropharyngeal space and medial to the neurovascular plane of the cervical and brachial plexus and subclavian artery. As you can see in this diagram, let me show you. You can see in this diagram that we can see the splitting or the different layers of the deep cervical fascia of the neck. The yellow line covers the prevertebral layer. Here, this is the prevertebral layer. Because you've read this topic, so you must be knowing that the deep cervical fascia has 4 layers. Let me show you that too. Here in this diagram, you can see that layer 1 is the investing fascia, which envelopes all the muscles of the neck. Layer 2 is the pretracheal fascia, this. Layer 3 is the carotid sheath, right? And layer 4 is the prevertebral, this layer. So prevertebral layer is the one which covers these muscles. Here in this diagram, you can see that this yellow line indicates the prevertebral layer, right? So now you can well imagine the exact location of the prevertebral region, right? Okay. Now, what are the contents of the prevertebral region? Number 1, we have the anterior vertebral muscles, which consists of number 1, longus colli, which is this, right? And then we have longus capitis, this muscle. We have scalenus anterior. We have rectus capitis anterior, which is this muscle. And then we have vertebral artery. The course of the vertebral artery has been described in my previous lecture, right? So I just wanted you here to have a look at the muscles so you can exactly know where they are located. We will talk about them individually in the next slides. Okay, now this is the number 1 muscle, longus colli, in the prevertebral region. If you have a look at it, it is divided into 3 parts. An upper part, middle part, and a lower part. So talking about the origin of the upper part, it originates from anterior tubercles of transverse process of C3 to C5 vertebrae and is inserted in the anterior tubercles of atlas. So this muscle that you see here, this is divided into an upper part, a lower part, and a middle part. Okay, so we talked about the origin and insertion of the upper part. Talking about the middle part, we have the origin is the anterior surface of the bodies of C5 to C7 and T1 to T3 vertebrae, and it is inserted into the anterior surface of the bodies of C2 to C4 vertebrae. The lower part rises from the anterior surface of bodies of T1 to T3 vertebrae, and the lower part is inserted into the anterior tubercle of transverse process of C5 to C6. It must be a little confusing for you right now, but when you have a look at it and when you just try to make it out in your brain, I think it's not very difficult to learn the original insertion of the three parts. So this muscle is the longus colli. Now next is longus capitis. Longus capitis muscle. The capitis word is used when we're talking about the cranium, right? So the origin is from the anterior tubercle of transverse process of C3 to C6 vertebrae, and insertion is into the inferior surface of basic occiput on either side of pharyngeal tubercle. Okay, so in the upper diagram you can see the location of the muscle in this diagram. This is the location of the muscle. Okay, longus capitis. Okay, the next is rectus capitis anterior. The origin is the anterior surface of lateral mass of atlas and the root of transverse process of atlas. And the insertion is inferior surface of the basic occiput in front of the occipital condyles. Okay, in this figure you can see rectus capitis anterior is this muscle. Okay, and here you can see the location of it. Okay, the last muscle in this region is the anterior scalene, scalenus anterior. The origin is from the transverse processes of typical cervical vertebrae, C3 to C6, and the insertion is the scalene tubercle of the first rib. In the upper diagram, you can see scalenus anterior, scalenus medius, and scalenus posterior. But in this region, that is the prevertebral region, we just talk about the anterior scalene, scalenus anterior. This is the base of the cranium, and here I just wanted you to have a look at the muscles. Have a look at this. This is the pharyngeal tubercle. These are the occipital condyles. Let's go on to the next diagram. Here you can see that this is the occipital condyle and the muscles in front of it, rectus capitis anterior, and lateral to it is the rectus capitis lateralis. Okay, so these are the four muscles that lie in the prevertebral region: longus colli, longus capitis, rectus capitis anterior, and anterior scalene muscles. I hope you can identify them from this diagram. Okay, now coming over to the next region is the paravertebral region. The lateral vertebral region in the deep neck contains two scalene muscles: splenius capitis, levator scapulae, rectus capitis lateralis, cervical plexus and branches, including the phrenic nerve and the cervical pleura. These are the contents of the paravertebral region. As you can assess from the name, it's paravertebral, which means it lies on the sides of the vertebral bodies. The prevertebral region was in front of the vertebral bodies, and the paravertebral region is on the sides of the vertebral bodies. Okay, now in the paravertebral region you can see the muscles. The muscles are rectus capitis lateralis. This, we're talking about the paravertebral region, remember it. Then we have splenius capitis, which is not shown in this diagram. We have levator scapulae, which is also not shown in this diagram. Okay, maybe in the next diagram or in the next slides we will be able to see them. And then we have middle scalene and posterior scalene. This is the scalenus medius. This is the scalenus posterior. Okay. Rectus capitis lateralis. The first muscle that we see here in the paravertebral region is the rectus capitis lateralis, and the origin is the upper surface of transverse process of atlas, The insertion is inferior surface of the jugular process of occipital bone. In the right hand side diagram, this is the location of the rectus capitis lateralis. Okay. Then the next muscle is splenius capitis. The origin is, so it is divided into three parts: cervices, capitis, cervices and capitis, but right now we just want to talk about the capitis one. So lower half of ligamentum nuchae and spinous process of C7 and T1 to T3. The insertion is mastoid process in occipital bone. Okay, and in the right hand side diagram you can see the location of the splenius capitis. This is levator scapulae. The origin is from the posterior tubercle of transverse processes C1 to C4, and the insertion is the superior part of medial border of scapula. Okay, now in this diagram, this is cadaveric diagram, and I just wanted you to have a look at the muscles. The muscle painted in purple is levator scapulae. Okay, this portion is trapezius muscle. This muscle is splenius capitis, and the purple one is levator scapulae, and this is semispinalis capitis. We're going to talk about these muscles in the next slides. Okay, middle scalene muscle. Origin is transverse process of lower 6 cervical vertebrae. Insertion is upper surface of the first rib. Posterior scalene. Origin transverse process of C4 to C6, and insertion in the second rib. I just talked about the above right hand side diagram in the previous slide also, that these are the three scalene muscles. The first one is anterior scalene, the middle one is the scalenus medius, and the third diagram on the top right hand corner is the scalenus posterior. Now have a look at this diagram also. This is scalenus anterior, medius, and posterior. You just have to identify them, and you must know about their origin and insertion. Now here in this slide also, you can have a look at the three scalenes: anterior, middle, and posterior scalenus. Here you can see the relation of the brachial plexus with the scalenus anterior and scalenus medius. And you can also see the subclavian artery here. Cervical plexus I'm going to teach you in a separate class. Then we have the phrenic nerve. The phrenic nerve, as you can see here in this diagram, these are found at the lateral bodies of the anterior scalene muscles. Whenever we want to have a look at the phrenic nerve in the neck, we'll just try to find the scalenus anterior, and the phrenic nerve is right there in front of it. It arises mainly from C4 nerve with contributions from C3 and C5. The phrenic nerve descends anterior to the anterior scalene muscles under cover of the internal jugular vein and the sternocleidomastoid muscles. They pass under the prevertebral layer of the deep cervical fascia between the subclavian arteries and veins and proceed to the thorax to supply the diaphragm. The phrenic nerves are important because in addition to their sensory distribution, they provide the sole motor supply to their own half of the diaphragm. Okay. Now, I also want to tell you about the root of the neck. Now, all the structures that pass between the head and the thorax or upper limb and thorax must pass through the root of the neck. The root of the neck is at the thoracic inlet, and the boundaries of the root of the neck are formed anteriorly by the manubrium sterni, posteriorly by the body of the first thoracic vertebra, laterally the first rib and costal cartilage, central markers scalenus anterior. The contents of the root of the neck include the cupula of pleura extends up into the neck, over the apex of lung 2 to 3 centimeters above the medial third of clavicle, subclavian vein, thoracic duct and right lymphatic duct, subclavian artery, vagus nerve and phrenic nerve. You've got to learn these contents because this is an important SCQ. Okay, here also this diagram shows the root of the neck and the boundaries of the root of the neck. I included this slide because I just wanted you to learn the structures that are passing through the root of the neck. And here in this slide, they are described in a little bit more detail than the previous one. So the vessels that pass through the root of the neck are the brachiocephalic vein, internal jugular vein, subclavian vein, thoracic duct, left side only, right brachiocephalic trunk, common carotid artery, vertebral artery and subclavian artery. Now this last diagram, I just wanted you to have a look at it because this diagram may be placed in the OSPE setup for the final stage. So just have a look at the muscles and revise them so you know which muscle is which. Okay, so I'll revise it with you. A is rectus capitis anterior, B is rectus capitis lateralis, D is longus colli, okay, E is scalenus anterior, F is scalenus medius, G is scalenus posterior, and C is, can anyone make it out? Do you remember the second muscle that we talked about in the prevertebral region? The first one was longus colli and the second one was splenius capitis. Okay, thank you so much. No, students, this is not splenius capitis. Splenius capitis was at the back of the neck. This is longus capitis muscle. So C is longus capitis muscle. Okay, thank you so much.